Welcome. Today we are going to demonstrate the intra and extraoral exam. We have Monica as our operator and we have Allison as our patient. The first thing you're going to do for the intra-extraoral exam is you're going to assemble the armamentarium required for the procedure. You're going to need a mouth mirror, a 2x2 gauze, a tongue depressor, and a cup of water in case you need to help your patient swallow. The next thing you do is you're going to explain the procedure and the steps to your patient. Then you are going to obtain informed consent from your patient. The next thing you want to do is review the assessment information, including the medical dental history, the extra-oral, intraoral findings to determine if there's any contraindications or modification to treatment that may exist. You're going to have your patient assessed by an instructor before commencing any intraoral procedures. You're going to also demonstrate appropriate access through optimal patient-operator positioning, use of the mouth mirror, and use of the dental light. For the purposes of this demonstration, we are not going to use the dental light, as well as we're going to keep Allison sitting straight up so that you're able to view the demonstration properly. The first thing that Monica is going to do is she's going to observe the symmetry of the head and neck of her patient. If her patient is wearing glasses, she is going to remove them. She is then going to visually observe and bilaterally palpate the parotid glands. She is then going to bilaterally palpate the auricular lymph nodes, first the anterior, then the posterior, then the superior, and lastly the inferior nodes. Note that she is only using 2 fingers to do this procedure. She will do one side first and then do the other side. Next, she is going to bilaterally palpate the occipital lymph nodes. She is then going to use her thumb and finger to bilaterally palpate the submandibular, the sublingual glands, as well as the chin mentalis muscle during swallowing. After that, she's going to use her fingertips in a circular motion and compress along the jaw from the symphysis to the posterior border of the mandible. To check the thyroid gland, she is going to use bidigital palpation just below the Adam's apple. Next, she is going to use circular digital compression on the gland and have the client swallow to check the larynx using bilateral palpation.
Go over one more time.
Next, to check the superficial cervical nodes, she will have her client or her patient turn away, palpate with her fingers along the sternocleidoid mastoid muscle from the mandible to the shoulder. Next, she is going to check the deep cervical nodes. She is going to have her patient put her head straight and she's going to palpate with her finger and thumb along the sternocleidoid mastoid muscle. Next, she's going to check the TMJ with bilateral palpation, placing her fingers just in front of the ears. Ask her patient to open and close. Listen for sounds. Have her patient move her jaw from side to side as well as front to back. Ask her patient, do you have any pain? And listen for crepitus or crackling. Now we are going to go intraoral. In order to do this, Monica is going to wash her hands, don on some gloves as well as a mask. Normally you would be doing this technique with the client lying in a supine position, but for demonstration purposes we are going to keep Allison sitting straight up. So once Monica dons her gloves, the first thing she is going to do is she is going to check the lips. She will check the lips by retracting the lips with her fingers and thumb, checking the labial mucosa, the alveolar mucosa, the gingival mucosa, and she will do that by palpating. Next, she's going to use her mouth mirror and she's going to reflect her overhead light to check the buccal mucosas. She's going to observe the buccal mucosas and then she will palpate both sides between her fingers and thumb. Next, she will use her mouth mirror to check the hard and soft palate. Once again, you would want to use your overhead light to reflect light so that you can see the hard and soft palate. If your patient has any edentulous ridges, you would want to compress those ridges with your fingers. Next, she's going to use her tongue depressor to check the oropharynx. She's going to have her patient say ah. She's going to check the palatine and pharyngeal tonsils, the posterior and pharyngeal wall, the uvula, as well as the anterior and posterior pillars. Next, she's going to use a 2x2 gauze to visually inspect the tongue. You want to make sure that you inspect the ventral surface, the top of the tongue.
Stick your tongue out.
She'll ask her client to stick her tongue out, as well as the lateral borders, the sides of the tongue, and the dorsal surface, the underside of the tongue. Lastly, she is going to check the floor of the mouth. She will first visually inspect, and then she will bimanually palpate. And that is the end of our intra-extraoral examination demonstration. Thank you.